Now we're going to talk about the bisphosphonates. The bisphosphonates are drugs that decreases the osteoclastic activity because the bisphosphonate is taken by the osteoclast and produces apoptosis, and so the osteoclasts die, and so there is no resorption of the bone, and so there is decrease now in the demineralization. So this is used mainly in osteoporosis, but also could be given in Paget's disease or in parathyroid, in hyperparathyroidism, etc. This when we already have the lesion in the bones, or we want to prevent the bone lesions. Remember, osteoarthritis cystica, bone marrow replacement with fibrous brown tissue, cystic spaces, hemorrhage, control hemorrhage, hemosiderin, saltpeter appearance, superior stalagmitic, and renal osteodystrophy, superior stalagmitic. So we use the bisphosphonates. The bisphosphonates are divided into the more potent and less potent, or simples. The more potent have nitrogen, and these are zoledronate, alendronate, and risedronate. And the simples are ivadronate and fluodronate. The most used one is alendronate, and the adverse effects are esophagitis. So the patient must take them in the upward position and nothing to eat in 30 minutes or so, with water, and is contraindicated so in patients with problem in the esophagus or GI tract, conditions that obstruct the GI tract, like a bypass, gastric bypass, or Barrett esophagus, and problems in the motility of the esophagus, that would be achalasia. Next, the adverse effects in the bone, it could be fractures due to osteonecrosis. Usually the osteonecrosis would be osteonecrosis of the jaw, as opposed to necrosis avascular seen in excess cortisol, that is seen in the femoral head. So these are the bisphosphonates we mainly use for osteoporosis, and the mechanism of action is inhibition of the osteoclastic activity due to apoptosis of the osteoclast.